As you prepare for the surgery, it is perfectly normal to be both nervous and excited at the same time. We want to reassure you that we will do everything possible to make the process as comfortable as possible. We have prepared this video to give you a step-by-step explanation of what will happen during the surgery. However, Dr. Lee will guide you during the surgery, so if you prefer not to see the video, please inform our staff. To relax, you will have the option of taking a very mild sedative called Valium. Unless you have an allergy or a personal reason not to take this medication, we recommend it as it will reduce anxiety. After taking one, if you feel more is needed, please let one of our staff members know. As you are aware, LASIK is a two-step process. At CCRS, we perform the first step of creating corneal flap with VisiMax laser. The second step of vision correction is done with the Allegretto EX500 laser. These lasers are currently the most advanced systems with many safety features. Along with Dr. Lee's guidance during surgery, you will be undergoing the most advanced LASIK surgery available today. Before your surgery, our staff will put antibiotic drops in your eyes and offer you Valium. Once you feel ready to proceed, you will be escorted to the surgery room. You will be seated on the laser bed and a surgical cap will be placed over your head. We will give you a soft, fuzzy stuffed animal as a comfort item. Holding onto this will also help to prevent you from accidentally reaching up and touching your eyes. Our friendly technician will lay you down and offer you a blanket. Please let her know if you do not wish to be covered. Dr. Lee will begin the process by putting numbing drops in your eyes. He will then tape one eye and help you open the other with a device called speculum. While this device will prevent you from closing your eyes, the act of blinking will cause the eye to rotate, so try to keep your eye straight throughout the procedure. You can inform Dr. Lee if you experience discomfort and he will apply more numbing drops. Dr. Lee may also rotate your head for better positioning and will ask you to look at his fingertip. He will then apply more numbing medication with a surgical sponge by gently brushing it against your eye. During this process, try to resist the temptation to look away. This process also serves as a good practice of keeping your eye steady during the actual procedure. Dr. Lee will bring you into the proper position, at which time you will see a blinking green light. Dr. Lee will then raise the bed and bring your eye in gentle contact with the treatment eyepiece. You will feel a very mild pressure and the laser treatment will begin. As the procedure comes to an end, the green light will disappear. However, you should continue to hold your eye steady until the procedure is complete and the eyepiece detaches from your eye. Throughout this process, it is more important to keep your eye steady and be relaxed rather than trying to follow the green light. Dr. Lee will make sure that your eye is in a perfect position throughout the surgery. Once the process is completed for the first eye, Dr. Lee will perform the same procedure on the second eye. Once the flap is created in both eyes, you can open your eyes, but please remain lying down until our staff helps you to sit up. Congratulations! You are now halfway through the LASIK surgery with the creation of the perfect flaps. For the second phase, our staff will assist you to move to the adjacent bed. Once you're comfortably positioned under the second laser, Dr. Lee will give you more numbing drops and help you open your eye once again with a speculum. You will see a flashing green light. Dr. Lee will then perform the final preparation, during which time you will feel your eye move. Try to keep your eye steady unless Dr. Lee asks you to either look up or down. Following this final preparation, Dr. Lee will ask you to look into the green light and begin the laser treatment. The EX500 is equipped with the most advanced eye tracking system and will remember your natural eye position. So unless you actively look away from the green light, the laser will compensate for any small eye movements. Dr. Lee will also guide you through the process and stop the treatment if there is excessive eye movement. When the laser treatment is completed, Dr. Lee will position the flap back to its natural position and give your eye a rinse. During this time, look straight and try to resist the temptation of closing your eyes. Finally, more drops will be put in the eye, and the same process will be repeated for the second eye. At the conclusion of the surgery, please remain lying down until our staff assists you in getting up. Congratulations! You have just completed the most advanced LASIK procedure. You're now on your way to a clear vision free from glasses and contact lenses.